be awesome. So let's get to it. Okay, let's talk about post-operative pain. So you just had a procedure, you've had surgery, and you're in pain, as well as what to do with bleeding and different things. So smaller procedures like ingrown toenails, you don't need to do much. The general rule is elevate, ice. When you do ice, it's 20 minutes on, 20 minutes off. If you're a full-size adult and healthy and you have no kidney problems, 800 ibuprofen, 800 milligrams of ibuprofen 3 times a day is a good way to go. You have to watch out for kidney issues and stomach problems. If you have a history of ulcers or heartburn or any kind of kidney compromise, you shouldn't be taking NSAIDs, including ibuprofen. But if all else is healthy and fine, no matter what else you do, I would be taking 800 ibuprofen 3 times a day. Schedule it, whether you're in pain or not, for a couple of weeks. Ingrown toenails, you probably only need it for a day or two, but something bigger like bunion surgery or an ankle fracture, I would schedule that and see if you can get by. If you can't, the pain's mounting, then I'd move on to the narcotic that your doctor has prescribed. But icing is great. Some people ice just to ice. I don't usually recommend that unless you're in pain. So 20 minutes on, 20 minutes off, you're allowing the tissues to thaw out. You're trying to avoid the early frostbite symptoms, which can actually happen, so you have to be careful with that. But it can be very useful. Elevation is useful. If you go too high, it can actually act like a tourniquet. Your foot, amazingly, if you get it too far above your heart, gravity will act like a tourniquet. So just at the level of your heart or a little bit higher is fine for some swelling, pain. Now, if you're swelling just a little bit, and it's been a few weeks since surgery and it doesn't hurt, I don't worry that much about swelling. Maybe we'll do a compression wrap with an ACE bandage, but don't ice it and elevate it and compress it just because it's a little bit of swelling has appeared. The reason I say that is because too much icing, elevation, that cuts down blood flow and healing and might delay your healing. So don't go crazy on that. Really focus on your pain, and that's the key. So the first few days after surgery, this is when pain is going to peak. In my office, in my clinic, and a lot of my colleagues will do a very light steroid shot mixed with the local anesthetic right at the end of surgery, if it's appropriate. When you do that, the entire foot could be numb. If we've only worked on the big toe area, it may be just that part of the foot. But keep in mind, if we did surgery anywhere up here, it may be numb further down, because if you numb up a nerve here, anything distal to that's going to go numb. When you mix local anesthetic with a steroid, sometimes it potentiates the local. It may stay numb for days, which is fantastic. You can avoid that surgical pain that so many people suffer through. However, most people are going to feel pain within hours, if not a day later. So have the ibuprofen going, again, every 8 hours. If the pain starts to kick in, the most important thing is to protect your sleep. What I see time and time again is people stop taking other medications. They're in so much pain, they don't pay attention to their ibuprofen and narcotic schedule, and their pain mounts. So they don't get any sleep. And the next day they can't deal with the pain at all. They get into this spiral, they don't sleep again the next night. And people will really become irritable. They can have breakdowns, emotional crisis. Things can get ugly. So protect your sleep. That's the most important part. If you're not sleeping, talk to your doctor immediately. If he or she's unavailable, go right to the ER or Instacare. But try to figure out how to sleep so you have more energy, and you're healthier. You're going to heal a lot faster. So again, ibuprofen every 800 every 8 hours if you're the appropriate weight and health with your kidney and your stomach. Take your narcotics as prescribed. I would do the ibuprofen now, and then 4 hours later do the narcotic, and then ibuprofen, and then a narcotic. So something every 4 hours when you're in the real heat of battle, when pain is really the worst. Keep the ice handy, elevate it, and so on. Other things you can do, and this is just for my patients. Your doctor may have different instructions, but you're often going to have an ACE bandage wrapped all the way around the foot, or Co-band, that sticky, usually brown or multicolored bandaging that sticks to itself. If you're sitting down and you're elevating and the foot still is throbbing and it feels really tight, you can loosen up those dressing layers and see if that helps with the throbbing. A lot of times during surgery, we'll put a bandage on. You start to swell because you've just had surgery and the swelling doesn't kick in for hours or days. And so those bandages get very tight. So feel free to loosen that up. You do need some compression, so don't take it completely off and don't get into the gauze. Do not expose the incision for fear of causing an infection and contamination of wounds. But you can loosen things up. A lot of times my patients are going to be either in a post-op shoe, which they can loosen up if they're sitting down. The cam boot, these big, tall walking boots can definitely be loosened up. Loosen up the straps all the way up if you're sitting down and just open it up a bit, see if your foot just needed a breather. Initially, bandages are really big, they're really tight, and when you're asleep on the table and we're putting all this dressings in the boot on, you can't give us any feedback as to whether it's tight or not, if it's pinching. So when the numbness wears off, sometimes we need some feedback. We may tell you, go ahead and loosen things up and see if that helps. Again, if you have been instructed to wear a post-operative shoe or cam boot, the most critical thing is to wear it whenever weight bearing. Don't hop around on your crutches and expect that you're never going to touch the ground. Don't take any chances. I can't tell you how many people have broken the surgery I've done because they didn't wear their boot. If your doctor says wear a boot, wear the boot. If they say use crutches, use crutches. The hardware inside your body, if they're using plates and screws, is strong enough to withstand your weight, but only for a very short amount of time. Essentially, that's in there simply to hold the bones in the right alignment until they heal, and then they take over from a strength perspective. So the hope is that the bones will become so strong that eventually the metal can be taken out if needed. It's not usually necessary, but it could be taken out and you don't need it anymore. So the boot is going to fill the gap until the bone is strong enough. I can't overemphasize that enough. If you take your boot off and walk around the house, you may be looking at a second surgery down the road, or a less than optimal outcome. If you had a bunion procedure, for example, the correction may fail, it may slip to the side, and both of us will be unhappy with the outcome, mainly because the pressure was too great and we didn't keep our boot on or our shoe. So that's really important. A couple of things about icing. If you're putting the ice on the surgical site and there's so much dressing, so much gauze there that it doesn't seem to penetrate, you can't tell it's getting anywhere, you could put the ice up behind the knee if appropriate. There's nerves, large nerves that come down behind the knee and innervate large portions of the foot, and sometimes that'll work to numb things up even though it's not directly on the surgical site. So that's a trick. There are a lot of other things you can do as we get further out past the initial surgical pain time. TENS units can be useful. You put the electrodes on either side of the surgical site. That can help mitigate some of the pain. There are ice machines that provide a constant flow. They usually have kind of a harness you put around the foot, and that provides a constant flow of ice water within the harness that soothes the foot. I've had people try out acupuncture, which is useful. It doesn't last very long, but there's some good data there that it's better than placebo. When in doubt, call your doctor. If you are not sleeping, if you're not resting, and you don't feel like you're recovering, something needs to change. So that's a couple of things to consider. Pain is usually the initial big post-operative problem. The next biggest thing is bleeding. A lot of my patients are on blood thinners, whether it's aspirin or Coumadin or something as strong as that. Usually your doctors provide you with a plan, but even in the best case scenario, even with healthy people, people are going to bleed. So a couple of rules of thumb. If the bleeding patch appears through the dressing and that size of the bleeding is about that big, silver dollar or bigger, and it dries up pretty quickly, that's fine. The dressing doesn't need to be changed immediately. It's better to leave that dressing on than to take everything off and contaminate it and get a catastrophic infection. If the bleeding continues and the entire forefoot or rear foot starting to get really wet and the whole thing's bloody, it's worse to leave that dressing on because now the skin is getting so wet, it's going to become very soft and it's going to fall apart. The incisions are going to start to open up, infections and more bleeding happen, and it's a disaster. So you do want to change those dressings under the direction of the surgeon or doctor you're receiving care from. but it's important to change that quickly. So call your doctor. If they're not available, go to the instant care or ER you have available. But if it's bleeding a lot, do not wait. It's unlikely you're going to bleed out and die. It's possible, but with foot and ankle surgery, it's unlikely. But it's more about the skin health. It's more about the incision. When you make an incision in skin, you've cut through the skin, you've got this incision. We put the skin edges together, those two edges meet and start to seal off and close off and dry up pretty quickly. Within a day or two, things start to happen. If that's disrupted and there's a lot of fluid buildup and it's too wet, that there's a small gap forms, the layers of skin cells on both sides don't meet and start to seal off. And if that's disrupted long enough, let's say longer than a week or two, they will not come together. Now you've got this hole and the body has to fill it up from the inside out, or you've got to go back to surgery and have them remove stitches, make another incision and close it, and you start over on the healing process. So it's really important. Elevation and icing and wearing a boot all play a role in limiting the bleeding. If you walk too much, you're increasing blood flow, gravity's pushing a lot of fluid and blood down to your foot. And that's going to cause swelling and the incision is going to open up. So there's a lot of reasons, many layers of reasons why we tell people to do what they do. And sometimes they don't understand that, so they think they can just take matters under their own hands and do whatever they want. But there's a lot of things they might not understand of why we're saying these things. So that's really important. Don't be alarmed if your foot or your toes stay numb for a few days. It will come back. Sometimes that numbness starts off as a big area and it gets smaller and smaller every week until just the incision line is numb. That's pretty common. Occasionally nerves go to sleep and never wake up, even though they're not where we did surgery. Maybe it's the compression of the boot or the dressings, or just a protective mechanism of the body where it just makes things go numb to avoid pain. Sometimes those nerves never wake up and there's a large patch of numbness. That's one of the big risks of surgery that your surgeon should have gone over with before surgery, explaining that sometimes nerves are cantankerous. You may have occasional shooting pains, electrical shocks that shoot through the area. That is very common after surgery. Once the foot or area has woken up, you get these little zingers that kind of zip through there. That's the nerve recovering and developing a healthier state. Don't be alarmed by that. They should become less and less frequent. If it's consistent and constant, however, you should talk to your doctor because you may have a nerve impingement, or maybe the dressing's too tight and pinching a nerve. So that's not something you want to ignore, especially if it's consistent. But if it gets to be less and less frequent and it's totally random, don't worry, that should go away with time. But as always, talk to your surgeon, always ask the questions, don't hide anything from them. It's better to ask a million questions and be annoying than to hide something that could cause trouble down the road that could have been avoided. So just always ask questions. The most common things that get my patients in trouble is they don't tell me when they think an infection is starting or when bleeding happens. Now, infections are rare within a few days of surgery. That's just unless the surgery was for an infectious process. If it's virgin territory, there's no wounds, no infections before surgery, it's extremely rare that an infection could happen within a few days of surgery. So that's not likely. But a week to 2 weeks later, infection certainly can happen. So if your pain has peaked after a few days, you're doing everything we're talking about, and it's getting better and better, and then all of a sudden the pain starts to peak again, and you haven't been more active, you haven't done anything different, your foot hasn't been below your heart more often than it was before, you may have an infection, and that needs to be addressed immediately. That's a visit to the ER or call your doctor. Do not wait till the next day. Don't give it hours to get deeper infected. With infections, time is of the essence. Sometimes hours makes a huge difference. A day or two makes a massive amount of difference, so do not wait. That's an emergency. That's something, a phone call needs to happen, and a visit to the ER immediately. Bleeding, we talked about that before. Sometimes it's not bleeding, but there's blood accumulating underneath the skin. That's a really tricky one. That's a one for your doctor to determine if what's called a hematoma is happening. Hematoma is basically a massive bruise underneath the skin where the blood is pooling in a big pocket. The body can handle and dissipate a certain amount of bruising. It does it all the time. But if it becomes a big enough pocket, it cannot deal with that amount of blood. It'll probably start to drain through the incision. there's going to be a fair amount of pain, and bacteria loves that scenario. If there's a big pocket of blood, the bacteria uses that as a petri dish essentially, and infections happen very quickly. So if pain is spiking and you're not sure what's going on, always ask your surgeon and stay on top of those things. So just a quick review. You've had surgery, you're in pain. First things to think about are, am I taking a scheduled dose of ibuprofen every 8 hours if I'm able and my doctor's cleared it with me? Am I taking my narcotics consistently at the levels they have suggested based on your weight and your health? Is my boot on? Am I staying off of my foot? Or am I moving the joint as instructed? If you're not sure, again, ask your doctor. Am I elevating? Am I icing 20 minutes on, 20 minutes off? Am I taking a look at my boot, loosening it up if I'm sitting down, or my shoe, trying to get some more blood flow to the area and take the pressure off? Have I loosened up my dressings on the outer edges, the outer ace bandage or co-band layer? If I've done all these things and pain's not improving, especially if there's pain around the calf, you might have a blood clot, you might have an infection, call your doctor, but often those measures are going to be enough to take care of your pain. As always, remember that we are doing this for Operation Underground Railroad. These lectures are to help promote them, to help raise money for them. We should have our website on these videos. It's OURrescue.org. Go to their website, make a donation. Remember that doctor's visit is a valuable experience, and please make a donation that would be equivalent to a doctor's visit. That would be fantastic, make our day. Operation Underground Railroad helps fight child sex trafficking around the world. They do sting operations around the world trying to save kids from these horrible situations. Your donation will either help rescue these kids or help them in the recovery and replacement into a safer situation. So go make a donation. That would be fantastic.